Awesome. Great. So happy Thursday, everyone. Thank you all so much for joining us for another one of our Thursday morning webinars as we continue this time from folks working at home virtually. Hope everyone is staying safe and healthy at home when you are able to. We are really excited this morning to have our friends at the Latinos in the South help us with North Carolina Latinx response to COVID-19. For folks who do not know me, my name is Matt Martin, and I serve as the Grassroots Advocacy Manager here at the North Carolina AIDS Action Network. As we continue these webinars weekly, we hope that you will continue to join us. We're trying to do the best we can with our advocacy work as everybody is working virtually. So continue to join us for these. We've got a lot of cool topics coming up. I am now going to pass it over to Judith Montenegro with Latinos in the South as she guides us through this conversation. So Judith, the floor is yours.
Hi, good morning, everyone. Next slide, sorry, Matt. Welcome. My name is Judith Montenegro, and I'm the Program Director for Latinos in the South. It's a program by the Latino Commission on AIDS. Next slide, please. And a little bit about us. We've been working in the field for over 10 years here in North Carolina. We have an office, and we do community-based participatory research, community mobilization and advocacy, capacity building, and technical assistance. We're based in 9 states, North Carolina, Texas, Florida, South Carolina, Alabama, Mississippi, Tennessee, Georgia, and Louisiana. And the Latino Commission on AIDS actually has staff in North Carolina, Texas, Florida, and South Carolina through our sibling program, which is Hands United. And they are the CDC funded portion of our program that provides capacity building in the Southeast for those doing testing in non-clinical settings. Next slide. And I wanted to set the stage before we get to our work with our panelists by sharing a little bit about what is happening here in North Carolina with COVID in the Latinx community. As of April 15th, there were 289 laboratory confirmed cases in the Latinx Hispanic community. It's important to note that these are confirmed cases, so there are probably many more of folks that just haven't been tested. There have been 3 confirmed deaths. And some other notes that we know is that Mecklenburg County has had the highest number of Hispanic and Latinos and members of the Latinx community represented in those cases. And additionally, we know that in 2 processing plants, one in Siler City and one in Sanford, folks recently were tested positive. So that does create some challenges based on sort of the work sector and employment area that many of the Latinx and Hispanic community work in here in North Carolina. So with those notes, next slide, please. I also wanted to share some notable federal policies to mention. So Immigration and Customs Enforcement has announced that they wouldn't do any enforcement near healthcare facilities, and that includes like doctor's offices, emergent or urgent care facilities or hospitals. And the thought is that people should not be avoiding seeking medical care because of fear for immigration enforcement. However, this doesn't address like the issue of people having to travel to the emergency rooms or to their clinics offices. And in many places in North Carolina that still have 287G contracts with law enforcement and immigration and customs enforcement working together. Definitely the fear of getting stopped by law enforcement is still very present regardless of whether we're in a pandemic or not. And there are conversations about criminalizing COVID transmission. And so these are all things that impact the Latinx community in a very unique way. We also know that getting tested and receiving treatment or preventative care for COVID will not be considered a public charge. A few weeks ago, our friend from AIDS United, Alex Vance, sort of talked a little bit about public charge and what it was. And public charge, for those of us that aren't as familiar with some of the immigration rules, is a ruling that is a ground for inadmissibility and reasons for a person to be denied a green card visa or admission into the US. And so a immigration officer can decide to grant that applicant a green card or visa to a person could deny it to a person who might become a dependent on certain government benefits in the future, or who has used them in the past. And so getting tested is not being considered public charge. Public charge was in the news very often in the past year because of changes occurring in public charge and how it was defined. And so it's very present in our community. I'll also mention that the CARES Act left out many Latinx individuals, particularly undocumented immigrants and mixed status families. So Latinx folks are one of the populations most at risk for unemployment because of their concentration in certain industries affected by closures, like service industries, hospitality, like restaurants, and that type of industry. And for the CARES Act, in order to receive some sort of stimulus, an individual must have a Social Security number to qualify for the stimulus payment. And that includes for receiving relief for your children. So if a family, a couple is filing jointly, both spouses have to have a Social Security number, except if one member is in the military. But an individual tax ID number or ITIN, it doesn't count in terms of receiving a stimulus payment. And those families with mixed status households will also not get a stimulus payment for their children. So there's a lot of things to consider in terms of who is benefiting from this and who is being currently left out. And so this is impacting many, many families in ways that I don't think we foresaw. And so with laying sort of that federal and a little bit of the statewide view of what is happening, I want to turn it over, next slide please, to Antonio del Toro. And Antonio is the executive director of the Western North Carolina AIDS Project. He's worked in the HIV care and prevention field for over 12 years, 8 of those at WNCAP. And he's had a variety of roles, including case manager, project manager, and associate director. And one of his priorities is to continue to shift that agency culture to be more inclusive and to create opportunities for client engagement on different levels throughout the organization. Antonio has helped standardize and significantly expand harm reduction services and has helped develop a peer navigation program for people living with HIV. Antonio is, I believe, the only Latinx executive director of an AIDS service organization in North Carolina. So welcome, Antonio.
Thank you, Judith. Please bear with me as I share my screen, everybody. While I do that, thank you to Latinos in the South and NCAN for putting this together and for inviting us to speak. Screen will be shared momentarily. Here we go. Can everybody see that? Yes. Okay, so this is a presentation kind of on what have been challenges, what already existed, and then how those challenges are exacerbated by COVID. But I thought I would start by giving you an overview of our agency, Western North Carolina AIDS Project, also known as WNCAP. WNCAP was founded in 1986 by a group of volunteers who were outraged by the stigma and cruelty they were seeing as the AIDS epidemic unfolded in our state and nationally. In WNCAP's early years, our founders and volunteers provided support and basically helped clients to pass away with dignity. As medical advances were made, WNCAP's scope of work grew to eventually include the 18 westernmost counties of North Carolina and to provide the following services: medical case management, targeted testing, counseling and referral services, free condom distribution, subsidized pharmacy services, harm reduction services, and peer navigation, and client engagement and advocacy activities. WNCAP serves over 300 persons living with HIV annually, and about 6% of our clients self-identify as Latinx. So a caveat before I continue, I think it's important to highlight that the Latinx community is very diverse, and so are our needs. So this presentation is based on experiences and fears of WNCAP clients and staff. I'm not trying to say that this is scientific research. So I think it's important to understand the barriers that already existed in order to get a sense of the barriers that we have now. So I thought I'd start out by just the regular things that make it difficult for Latinx community members to access care. So all of our Latinx clients are below 300% of poverty level. They work in jobs that are low wage. And they have, some of them at least have the additional pressure of sending remittances back home to support family. Most of our Latinx clients are uninsured. There's some employer-based coverage, but as a rule, generally the industries that they work in do not always offer benefits. And people who are employed who would generally have access to the ACA marketplace to purchase a plan, most of our Latinx clients are undocumented, so that's not an option available to them. Most of our Latinx immigrant clients come from rural regions in Mexico, Central and South America, and generally didn't have easy access to education beyond primary or secondary school. So they didn't have the privilege of learning a baseline health literacy that is sometimes assumed here. The majority of our Latinx clients are monolingual and require linkage to interpreting services or a properly trained and culturally competent case manager who understands the concept and ethics of interpreting. Some of our Latinx clients are justice-involved persons and require linkage to legal aid organizations, as well as the local navigation for the local justice system. And after these general barriers, I thought I would highlight the ones that are specifically related to immigration status. Undocumented immigrants are not eligible for SNAP. They are not eligible for Medicaid. I know that there are some circumstances where you can access emergency health care or prenatal care, but as a rule, it is not something that most undocumented immigrants can rely on. We're not eligible for Medicare, SSI or SSDI, unemployment insurance, the ACA marketplace, as I said earlier, or a North Carolina driver's license or state ID. As you can imagine, these barriers have only gotten worse with the COVID crisis. Economic instability has increased because of mass unemployment in service and hospitality industries, just like Judith was saying. This makes for more food insecurity and housing instability, again, in a population that doesn't have access to the usual safety net that other people could rely on. The few that had health insurance through their employers would lose it, obviously. Lacking a baseline health literacy, and also in combination with a potential language barrier, the Latinx population is vulnerable to COVID misinformation and confusing messaging. For those who are eligible, language barriers will make it really difficult to navigate unemployment benefit applications, charity care, and other safety net entitlements, especially when so many people are applying and overwhelming the systems. With loss of employment, they may not be able to afford legal fees. If something results in incarceration, whether a jail or a detention center, they would also face the risks of COVID transmission, since social distancing can't be adhered to in that kind of setting. And so let's revisit the barriers that are associated with immigration status. Spoiler alert, they're all still there, with a couple notable additions. COVID unemployment boost, the $600 that would be added onto the regular benefits that North Carolina provides. Undocumented immigrants are not eligible for it, nor are they eligible for the COVID tax credit, even if they were filing taxes using an ITIN and paying taxes. So this just goes to show that a safety net is not encompassing all of our population. And even for the population that it doesn't encompass, it's already rather inadequate, but it doesn't reach everybody. So I think it's important to prepare ourselves to be able to meet the moment. I think one of the ways that agencies can do that is by making sure that their policies have flexibility to be able to adapt. So what I mean by that is financial assistance guidelines, requirements, and limits should be evaluated to make sure that you're not excluding people who might need assistance in this kind of circumstance that is unprecedented, and under normal circumstances, you might not approve that kind of assistance. It's important to make sure that you are prepared to facilitate low contact medical case management. There's infrastructure that goes along with that. So, most case managers would already have a way to communicate with clients, but the infrastructure I'm referring to is more about electronic record keeping, coming up with procedures on how to collect signatures, etc. One thing that's helped us a lot is to have frequent crisis management meetings. This crisis moves very, very quickly. And if you don't have frequent meetings, it would really hamper your ability to act as the landscape changes. You have to be okay with unconventional work hours. Generally speaking, case managers work 9 to 5, Monday through Friday, but given the circumstances, there are all kinds of situations that might require them to work past 6 p.m. or on the weekends. Flexibility from grant makers would also be very helpful. Some are doing a really good job with this. Hopefully others will follow suit. One of the things that is helpful is to relax reporting expectations. This situation is all hands on deck, and so a lot of human resources are diverted to preparedness and planning. So people that would normally be working on reporting have to focus on other areas. So we would definitely appreciate relaxing reporting requirements. Deadline extensions, along the same lines, human resources are diverted to address the crisis. Another key one is to consider making allowable costs to include operational costs. We are fortunate that WNCAP has not been severely impacted by the economic fallout, although we did have to cancel our biggest fundraiser. So allowable costs, including operational costs, would give us more flexibility and make sure that we can cover all of our bases. There's also a need for flexibility in the sources of unrestricted funds. I would encourage every ASO to consider 340B. The 340B program is kind of a complex subject that could warrant its own series of webinars. So I won't go into the details, but I would just recommend that you learn about it on the Office of Pharmacy Affairs website. And at the end of the slides, you'll see my email address. If you have any questions, you're welcome to reach out and I'll call you up and we can talk about it. 340B is a source of funds that we can use to be able to expand the kind of services we provide with Ryan White and with ITCS. As I'm sure most of you already know, there are a variety of COVID-related emergency funding opportunities. Make sure to just keep an eye out for those and pursue them. One of the most flexible and most valuable dollars that we can get are dollars from individual donors, because those are completely unrestricted. So I would encourage everybody who has the means to support their local ASO wherever they may be. And if you don't have the means, support can also be volunteering your time. I would also encourage leaders of other organizations to make sure they adapt their development strategy to include grassroots fundraising. I think the community is kind of starved of ways to try to help. Everybody is just stuck at home. So I think anybody that has the means to help would. You just have to make sure that you are creating strategy around it and being genuine with people. And that's all I had.
Thanks, Antonio. And Matt, if you can share your screen again. Thanks. While he's pulling that up, I want to introduce Alma Rodriguez. She's our next presenter and the Associate Director of Prevention for the Alliance of AIDS Services. Alma has been working in the field for almost 10 years, and prevention and education are a true passion of hers, as well as taking the road less traveled has driven Alma to remain committed to the field where stigma and discrimination thrive. And Alma has been with the Alliance since 2015 and works in a very expansive area. So Alma, welcome.
Thank you very much for that, Judith. Hello, everyone. I hope everyone's staying safe and well. I'll go ahead and have Judith share her screen for my slides. So hello, everyone. As Judith mentioned, I've worked with the Alliance now for almost 5 years. And basically, I'm here to talk about HIV services and the Latino community and how the Alliance is striving to come up with ways, interactive ways that we can continue to serve the community on a limited capacity. Next slide, please. So the biggest challenge in serving the community, of course, is we cannot see clients face to face as much as we would like, cannot perform outreach in rural areas. We serve predominantly 4 rural counties in the area, and it's difficult to be able to do outreach just because of everything going on and social distancing and the requirements from the state. We currently also cannot visit our monthly sites like the Mexican Consulate, the flea market, specific sites to where we will reach the Latino community. We also can't do outreach in those areas. Next slide, please. So what are we currently doing with routine care services? So since we're not currently open, we are relying on folks as much as possible to check their social media pages, access care as much as possible through partnering organizations. And then we typically offer a free HIV STI testing. However, we are currently offering it in a limited capacity. So what we're doing is if someone is in need or if they have a concern, especially with HIV, then we can schedule them an appointment on an individual need and be able to service them that way. Our labs are also working on limited capacity, so we always strive to make sure that we can get the client the results back on time. Part of the good thing that we offer is that we do the HIV rapid testing. So if somebody's concerned, we can certainly offer that for them, scheduling appointments and then making sure that we just screen the client. For our HIV positives, we have had some appointments in the office for people that needed to be connected to care or somebody that, just found out their status. So what we're continuing to do there is we connect to care services through scheduling online appointments with bridge counselors. We've done that in the past month. We also make sure and follow up with the client to make sure that they were able to get to their first appointment. make sure that their information is with the state so that they can have any services that they may need. So those are part of what we're doing with our routine care services in a limited capacity. Next slide, please. So additional services that we do offer, we offer the food pantry, prep referrals, over the phone, online counseling services. With our food pantry, because we're currently not open to the public, what we're doing is from our CLEAR program, which is our counseling program that we have for people living with HIV, they notify our CLEAR counselor if they are in need of food, and we actually deliver food, you know, similar to what Amazon and, you know, all these other delivery places are doing. We'll actually take them a box of food and drop it off on their porch, let them know in case, you know, that they need that. So if there's a client that is in dire need, we can at least try to provide them with some type of food service so that, you know, they're not missing out on that part. In terms of prep referrals, they work similar to our testing. What we're doing is we're doing them, we schedule the appointment, and with the individual, they can email us or text us, and then we can see them in office, provide a rapid HIV test if needed, and then do the referral process so that they can get connected to care. Right now, one of the good things about our prep referral is that through our partner, the process has gotten a little bit easier in terms of the paperwork and in terms of what they need to fill out and what needs to get sent in to our pharmacy. So that we've made it, there's a little bit more of ease with scheduling during this time. So we have made out a call on our social media pages. So if anybody needs a prep referral, if anybody needs testing services, we're open to do that and, you know, to schedule those appointments, because as we know with cabin fever, sometimes it leads to boredom, and it leads to, you know, other decisions that we may make that are not so safe. And so we want to make sure that people are staying safe. The over the phone online counseling services to a limited capacity, we've been doing that with our CLEAR program. Our CLEAR counselors have their clients that they've been trying to meet, but as Antonio said, we're working out the details on having the folks later come in to do the signage and paperwork, making sure that, you know, we do the referrals, anything that's needed to the capacity that we can. Next slide, please. So how are we staying engaged with Latinx community members? So as I mentioned before, we're doing testing in the office as needed. We're providing incentives if able, you know, for people to also come in if they need to, but we've also provided that with any of our events that we've held in the past. One of the important things that we do is we do social media outreach, and along with the local radio station. We're in the process of starting a partnership with them where we're going to be going to their location once a month to kind of just let people know about our services, and also, you know, any type of resource that they may need that they can utilize. So that's a big thing too. I feel like some people nowadays, most everyone has a phone that can have a little bit of access to the internet. Most people listen to the radio. So those are good ways to reach the Latino community, especially in these rural areas. So that's something that we do. We're also partnering with the North Carolina Farm Workers Project. Our farm workers, as we all know, are one of our communities that, you know, continues to work and continues to have to be out there doing what they need to do. So what we're trying to do is work with the Farm Workers Project to get out there and still provide services as best as we can, still, you know, provide education, anything that they may need along with the Farm Workers Project, because they also give them food and resources and referrals and everything they need. El Centro Hispano, we also have an established relationship with them, where right now we're not serving with their Ventanilla de Salud in the consulate, but we're still trying to figure out ways to partner and do things online. One thing that we did too was offering educational workshops and sessions online with the LGBT Center of Raleigh. We're also looking at potentially doing that in Spanish as well, so that we can kind of continue to educate our Latinx community. Next slide, please. So how best can we support this population? Obviously, you know, offering free services, screenings, hosting events, seminars, community engagement with outreach strategies, and destigmatizing HIV testing. That's one of the things that, after being in the field, you learn, where stigma thrives, and one of the biggest things is in rural areas. We notice, that's a big thing. So we're trying our best to get out there and kind of, destigmatize HIV and all services, even though we're working to a very limited capacity. We're still trying to make sure, keep it fresh in people's mind that it's important to seek services when they need to. Next slide, please. So then that's pretty much it. Our information is below and our website. So if anybody needs any information or has any questions, please feel free to let me know. Thank you.
Thanks, Alma. And so I wanted to share, next slide, please, Matt. I wanted to share sort of advocacy and local opportunities, and I don't think I would be a good partner to NCAN or to this movement if I didn't start off by saying that one of the concrete ways that North Carolina can protect workers and Latinx families is by expanding Medicaid. And so because while many folks who are undocumented are not eligible for Medicaid, it does affect mixed status families and the availability of services. I think this isn't something we always talk about around expansion of Medicaid, but we need more healthcare providers, and not expanding Medicaid has led to hospital closures in a lot of rural areas, in areas where Alma and Antonio both work in. And so we are going to have a healthcare system that is going to be inundated by a lot of people who are uninsured due to unemployment. And so while COVID treatment may be covered for many folks who are uninsured, many other chronic and immediate healthcare issues will not be. So it's something to continue to push for and think about in that sense. I also wanted to take an opportunity. I know when we talk about the Latinx community, I think we all would hope that there would be one answer on how to best reach this community. And I can't sit here and say, like, if you make a YouTube video in Spanish, automatically folks are going to understand the extent of this pandemic and community. For many of the immigrants we work with and Latinx folks, people who are in this country from Latinx communities have already survived dictatorships, famine, civil wars. And so when we talk about a pandemic as something that is happening, it's not always as tangible as a threat as some of the other major concerns people have from day to day, like having to feed their children and having to make sure that they have housing and are able to have food to put on the table and be able to pay their bills. But I will say that North Carolina did take some time in getting materials available in Spanish, and often at local health departments around the state, you are seeing much larger health departments are able to provide information that's tailored to their communities in Spanish. And I know we have a lot of folks on the line who are working with Latinx communities, and I want to invite them to share some of the strategies that they're implementing currently in their locations and how they've addressed some of these things. I think Antonio and Alma shared some very specific ways that their agencies are addressing COVID in Latinx communities. But our communities, again, are not monolithic, and so they don't all look the same. So if anyone, I want to invite folks that if you'd like to chime in to share sort of what your local opportunities and advocacy efforts have looked like in addressing COVID in your communities now, or if you have questions before I share sort of what other ways you can support look like.
Hi, good morning. My name is Mayra Rangel. And thank you very much for supporting our community and to, invite us to be part of this weekly meetings, virtual meetings. And I work for a program that is called More in My Basket. In Spanish is Más en mi canasta. And what we do on a regular basis is that we assist people in completing their SNAP application over the phone. We help everyone in the community in North Carolina. This program is statewide. And the idea is that there's a lot of people that can not go to the DSS, or they don't want to go to the Department of Social Services for different reasons, lack of transportation, or they don't know what it is, or whatever. And so that's what we do on a regular basis. Right now, of course, we have done it even more because of the circumstances. So I just wanted to make sure that everybody knows about our program. Our website is morefood.org. Where you can find out more about the program, how it works, and it's both English and Spanish. I'm the bilingual outreach specialist, so my job is to go out there and explain our community how do we work. As far as how we pre-screen who is eligible or not, of course, we explain that also very well with our community. For instance, we have families where some of the kids, they have their Social Security, where the parents, they don't have it. Still, they can apply for SNAP or FNS. So they can give us a call or contact us on our website.
Great, thank you, Mayra. That's very helpful to know about this resource. And I've put it in the chat function for folks to be able to contact your organization. So thank you.
Thank you.
Anyone else would like to share?
This is Julia Giener. I work over in pediatric infectious diseases at Duke. And this is a little bit different, but with the COVID-19 pandemic, we're seeing a number of infections within the Latinx community. And I am working on research for pediatric infectious diseases. And part of the research we're doing is looking at some of the laboratory markers of when people are infected and in households. And as we know, a number of our Latinx community live in these households that may be multi-generational and have various families in it. And so it leads to a larger number of people becoming infected within the household. So we're looking at households where an adult has been diagnosed as a positive COVID case. And then we're getting samples from all of the children who are living in that household to see if we can see if they're infected, as well as how the virus is being shed. Part of that means that we're doing consents over the phone, and this is a little bit challenging. So the consents are happening with an interpreter, a bilingual witness, which I serve as the bilingual witness, and then whoever is actually doing the consent. But one of the interesting things that I've learned from this is that a number of times when we go to pick up the samples, we do this in a safe way so that we don't actually have any contact with the people who live in the house, because they could all potentially be infected. But household members always want to come and greet us and come talk to us. And so there really is a lot of education that we're having to do all the time. And I think that it's really important to understand the amount of education that is still needed within the Latinx community.
Great, thank you, Julieta. That's so important, and I think it speaks to sort of how culturally this is very different for us to have to be spatially distant from each other, where we're used to hugging and kissing each other when we say hello and goodbye. And I think I was talking to Pilar Rocha, the executive director of El Centro Hispano, and that has been, I think, one of the toughest things for her is going into the agency and trying to provide comfort and services to folks and not being able to be physically comforting to someone else. And so, yes, that makes a lot of sense. Anyone else that would like to share?
There is one other thing that I do want to talk about, and that is that that the HRSA, who provides grants for Ryan White, recently sent out notices of awards to the different Ryan White agencies, that they're receiving some money under the CARES Act in order to help provide services for people who are Ryan White clients. So that are people who are living with HIV, who are currently Ryan White clients, to help with testing, help pay for testing for them, help pay for emergency housing, help pay for emergency food services. And so various Ryan White agencies in the area are receiving those notices, and that is another source of some services.
Great, thank you, Julieta. That's very important to know. Anyone else that would like to share? Or anyone who has any questions for our presenters before I move on to some additional opportunities on how to support communities?
Hi there, this is Michael Pondel from WinCap, and I had a question about PEP, post-exposure prophylaxis, and if access to that has been made more challenging because of the current epidemic.
Alma or Antonio, do either of you want to answer?
I would imagine that it has become much more difficult just because, first of all, accessing PEP under normal circumstances is challenging in a setting like ours, in a rural area that doesn't have a lot of providers. And sometimes the left hand doesn't know what the right hand's doing. So it depends on who you speak to when you go to the health department on whether you'll actually receive the assistance that you need. This is anecdotal, so I'm not trying to say that this is the case across the board, but it's just complicated. And with all of the changes that are happening because of COVID, where we only do emergency care or urgent care, people are social distancing, they might not be able to go to the same places that they could go to in normal circumstances. So even though we haven't had a case where we've had to assist somebody in accessing PEP since COVID, I can imagine that when we do have one, it'll require more navigation on our part to make sure the person is linked to care.
Thank you, Antonio. Anyone else that would like to share? I know we have a few folks from the health department on the line. So I don't want to call them out, but if they'd like to share.
Hey Judith, how you doing? It's Omar.
Hi Omar, how are you?
I'm well, thanks. Unfortunately, I'm not a part of that team where the COVID response. We're still doing HIV testing. We are doing it in the clinic here in Mecklenburg County. So it is something that it's a little bit less than we used to. We're not doing the community testing, making it difficult for those higher risk communities. But yeah, we're soon going to be transitioning. I received a communication yesterday that part of our team is going to go work with COVID response, and I'm sure the Latinx community is going to need bilingual, so I'll probably be a part of that. But yeah, so that's kind of like my input for what Mecklenburg County's doing, at least with my area of the response.
Judith,
Yes.
this is Yvonne Torres.
Hi Yvonne.
Hi, how are you? Wake County we are all immersed right now in COVID. So the only things that right now are available locally for it is our STD clinic. People are being seen and but everything is done. They're still doing a lot of telehealth. And what I can tell you right now is that, for example, we have the services that are being provided right now at the local clinics are very limited. I mean, WIC is continued to provide services, but it's through telehealth. I believe right now, I'm looking right now because yesterday we had a meeting on what is continuing, but we're going to start immunization again for children who are 2 years under. And we also starting on Monday, Depo-Provera shots for women that had appointments. And so we're trying, but to be honest with you, a lot of our efforts have been on COVID. And I think that we now are starting a little bit to looking at possibility of how we're going to continue, serving the community. In terms of HIV, I can tell you that I have a set of social workers that are doing the continuity of work that needs to happen. I have staff that are dropping boxes of food for clients also. And then we are seeing in the HIV clinic patients who are urgent site visits, but we have scheduled the other visits if there is no any emergency. We have a schedule for later on during the coming up months, but everything is being done just to make sure that we protect the individuals coming into our building. So the pharmacy still working, and what they do is that they provide the services outside the pharmacy for our regular public health. For HIV, they have, I think that they have given that to local pharmacy to provide those, the medication through a local pharmacy. But the reality is that we're living in a different time right now, and our services are continuing. But we have right now two what we call two hotels that are serving people who are at risk for COVID, and one hotel who are keeping people who have been tested, who are tested or might be positive with COVID. So, and I think we're in the process of maybe open a third hotel. So right now we, as Wake County government completely is really providing services. And when I say Wake County government, it's not only public health, it's the entire government of the county are providing services based on the needs that we're having right now with COVID. And that it doesn't change the status of the individual in this country, that the services are still being provided. That is not a question that is asked or required for receiving services right now. That's the only thing I can tell you. Is it kind of vague, but the reality is that right now services are being done, but quite differently.
Great, thank you. And next slide, please, Matt. I did want to share some ways that community members can support each other. Currently, North Carolina does not have at county or municipal levels sort of these funds to support individuals. There are some small business funds available, but no individual support currently. And so that means that community needs to take care of each other. And so I've listed some ways that folks can support, either by donating funds or sharing these opportunities that are pledging to support undocumented individuals or individuals regardless of legal status throughout North Carolina. But I think one of the things that I'd like folks to take away from this is that a lot of the service delivery that is happening door to door, and folks having to reimagine the way they reach out to communities. I think that if your agency had trouble engaging with the Latinx community, it is certainly going to be much more exacerbated with COVID-19, where we are encouraging folks to be isolated and to not be, there's not like outreach events we can attend. Everything is moving to be much more virtual, which poses a lot of challenges for our communities in the sense that there are folks with, as Antonio mentioned, like limited technology literacy and also understanding of systems, as well as having to now navigate having children work from home with schooling. So there's a lot of things that are creating many stressors in the community, but these are some ways, some very concrete ways that we can support. I also encourage agencies to think about delivering medications, the less amount of time people have to drive for many community members, the better. And that way it prevents folks from having to engage with law enforcement. Some employers are providing letters in case people get stopped by law enforcement for being out and having to go to work. However, this is not a driver's license, so this form really just says I'm an essential worker, however, I don't have a driver's license.
Judith, this is Yvonne again. One of the things that I know that my staff, especially our HIV case managers, we have meetings every day with the supervisors. And one of the things that they're mentioning is also something that is also crucial with people who are HIV positive. And that is right now, some of them really, the stigma of being HIV positive in the past already have caused them to be sometimes isolated. But with this COVID, the isolation is even more. And the importance of case management to continue having calls to the clients just to check on them for only the mental health component and the connectivity with another person that they can share information and don't feel isolated again, because this is a second isolation, like I call it. So for when, for example, my social workers go and drop food, that we have to keep, distancing and all that. But sometimes they hang apart, in distance, but they stay with the client to have a conversation with them, not necessarily related to HIV, to their diagnosis, but really to just check on them mentally and having just that human-to-human interaction. So I think that one thing that I have encouraged my staff is to have those, to make intentionally those specific interactions, because it is as important as delivering the food or medication that they might need. And I think that we need to, in some ways, and we don't have anything really yet that set up, for maybe we have it for the community that do have access to mental health, but mental health through telephone or telehealth, I think is as important as the physical health, especially in this situation. So I hope that at least for me in the future, how can we create those venues that if this happens again, or if it continues, or we have a second wave or whatever, that we have that in place so clients have been able to be supported that way. That's one of, when I'm looking at systems and how can we improve some of our system, the medical piece and the HIV piece and the medication, food, we all doing that, but the mental health of the individual is the hardest one. It's always been hard regardless, but now I think it's even harder.
Absolutely. And I think that the point of addressing stigma, and one of the things I think I forgot to mention is that for many folks who have been living apart from their families, for many immigrants, having conversations over technology is not new. And so it is just about reframing these things to address different concerns. And it's something that our agencies have to get used to. Matt, if you can go to the next slide. Yes, so it looks like we're out of time, but we had a really great conversation. And I think that many of the folks who participated and shared, including myself and Alma and Antonio, I'll speak for them as well. If you have any questions or need additional information or would like to talk through some of the strategies you're thinking of implementing to reach out to the Latinx community, if you haven't had experience working with the Latinx community or have had maybe some less than fruitful outcomes, please definitely contact us at the Latino Commission on AIDS. We provide capacity building and are very willing to sit down and look at the strategies you all are using and doing some segmentation. So thank you all, and thank you to the North Carolina AIDS Action Network.
Awesome. Well, thank you all so much for everyone joining us. We wanted to make a couple of quick announcements before we called it. I know we're a little past 11, so if you need to hop off, feel free. We will be sending out all of the slides that you saw today in our follow-up email, as well as a couple of links, including our 2 upcoming webinars. Let me again say a huge thank you to Judith, Alma, and Antonio for sharing this wealth of information, as well as others who contributed. I think it's really vital in this time to continue to build community and to share how we can best support each other. So thank you all for sharing that with us. Did want to plug our 2 upcoming webinars as we continue these Thursday morning webinars. So next Thursday, friend and advocate of North Carolina AIDS Action Network, Margot Lester, will be hosting a Writing for Advocacy, Capture the Power of Your Ideas webinar to talk about how we can do some advocacy writing in this time, whether that be letters to editor or blog posts, but how to best get your thoughts into action via some writing strategies. And that will be next Thursday at 10 a.m., April the 23rd. And then April the 30th, the Thursday after that, we will be joined by some folks at the Health and Law Policy Innovation Center of Harvard Law School. And they will be talking about fighting religious and moral exemptions to care, specifically around a Supreme Court filing that was recently launched that we signed on to. So take a look out for those. I will include those in the email that we send out later along with the slides from today. Another quick plug, as Judith mentioned, I think as we continue through the uncertainty of COVID-19, expanding Medicaid is a huge thing that we need to really consider here in North Carolina, and it's time for that to happen. We will be working with our friends at the Health Access North Carolina Coalition, hosting a call-in day tomorrow. I will send out the number that is a call-in script that will link you directly to Senator Berger and Speaker Moore, and encouraging them to expand Medicaid now, because now is the time. So take a look out for that in your email later this afternoon. Again, a huge thank you to everyone who joined us today. Y'all have a great rest of your Thursday. Stay safe, stay healthy, take care of yourselves, and we look forward to seeing you next Thursday. Bye, everyone.